Substance use IOP is an intensive outpatient program. We run 3 groups a week, and we would see you for 1 individual session a week. It's a higher level of care that we offer in outpatient services, kind of an attempt to give you more support, structure, routine throughout your week before we need to explore a high level of care or after you come from a higher level of care. I would say anyone who is motivated to make changes in their recovery, the biggest thing for IOP is definitely like that piece of motivation. Anybody who's struggling to get to the first steps of recovery, or somebody who's looking for structure, like I said, or support after coming from a higher level of care, it can be really helpful to have that extra level of support and groups and meeting people who are also in recovery. So anybody who's really looking for a little bit extra and not really sure where to start maybe or what to do next, it can be helpful to be in the program.
Patients can be referred to the program through their primary care counselor, so their intake counselor, or if they have a primary care counselor and outpatient right now, they'll complete the referral process.
We offer all different kinds of times, and we offer different modalities as well. So we have an all virtual option, and then we have an all face-to-face track as well. And the groups are also staggered at different times to accommodate people with busy schedules.
So it's an 8-week program with 4 services a week. Groups are 3 times a week, and then the one-on-one is once a week. And we cover a whole slew of topics. I usually explain it from like everything from mental health to substance use and in between. We talk about harm reduction. We talk about triggers and relapse prevention, but we also talk about co-occurring disorders and mental health, sleep, nutrition. Pretty much anything you can think of, we at least touch on it a little bit. I don't think that your success in the program relies on total abstinence. I think a lot of what the program provides is structure, right? We focus on progress and not perfection. Recovery is not a linear process, and we acknowledge that, we recognize that. So when every patient comes into their initial IOP appointment with the IOP counselor, we go over what their specific goals are. So sometimes it's learning and figuring out how to identify triggers or how to implement coping skills. And we kind of track our progress based on those initial goals. So at the end of the 8 weeks, if we can go back and review those initial goals and say, we checked all of these off, you're able to do all of these things, in my eyes, that's successful completion.
I think I've really seen them start to celebrate their recovery. So this evolution between it feeling like this daunting task to it being something that they really identify with. Some of the benefits I've noticed are just the sense of connectedness between patients, seeing the same group members every week, working with their one-on-one counselor up to 4 to 5 hours a week as well, a sense of accountability through that, and then seeing patients a little apprehensive in the beginning of the program, especially with hearing an 8-week program lies ahead of them, and then seeing them commit themselves.
What I have seen, people leave feeling more in control of their lives, more confident in their ability to not necessarily be sober, but apply the skills that they've learned. And I think that they overall just really have more of an understanding of who they are and what they need.